So let's take a look at what you're saying online. There's a lot of feedback coming through at Trevor Mbija at Citizen TV Kenya. Use the hashtag Monday Report before I get to my panelists and my brilliant panel of young people and hearing what their thoughts are. Steve Mulwa says, I think the first step to eradicate the consumption of tobacco is the government to put some measures like high taxation, stop advert promotion of cigarettes to be sold in bars and not in retail shops, and no single stick selling. Okay. See what else you're saying here. Engineer Kyoko Justo says, Trevor, people are planting tobacco as a cash crop to earn money. It is money that people need to sustain their lives, not specifically food alone. Planting maize or beans that everyone plants has not enough profits or good money than tobacco. My take, though. All right? See what else you're saying. Honorable Lilian Sioy says this campaign raises awareness about alternative crop production and opportunities for tobacco farmers and encourage them to grow sustainable, nutritious crops. All right, let's see what else you're saying here. Got a number of them. We'll see if we can squeeze them in. Wamai Gisheru says, why was Tobacco Control Unit moved from State Department of Public Health to State Department of Medical Services? Yet tobacco control activities is purely a public health function. Okay? Areba says, personally, I don't smoke, but I spend lots of time around people who smoke, especially during weekends. Long term, how harmful is that? Long-term effect of people, secondary smokers. Caleb Masinde says, what are the challenges that farmers who are trying to transition away from tobacco production face? What is the government of Kenya and other organizations doing to help farmers who are trying to transition away from tobacco production? That is at the national level. Dr. Dorcas will answer that for us. Okelo Molimu, a country that struggles with food insecurity can never purport to be capable of providing adequate housing units for downtrodden. Rather than forcefully pushing housing levy through our throats, this is during my news conversation that the feedback that's coming through on this. All right, let's take a look at what more you're saying here, the young people. There's still a microphone over there, and then we'll go back to this side. But Dorcas and Dr. Adriana, the questions will come to you right after this. All right. Yes. Start with the name, sir.
Yeah, thank you, Trevor. My name is Thomas Lindy. I'm the coordinator of the Kenya Tobacco Control Alliance. Now, my issue is with the media, and I think for a long time, the tobacco industry has been taking advantage of the media, advertising their products, using some journalists to write some sweet stories about the successes of tobacco farmers, whereas on the other hand, these people are suffering the issue of the diseases that we are talking about here. So this happening, maybe we are heading towards World No Tobacco Day. I'm sure the other interview maybe will be calling for tobacco control guys to come, will be the other World No Tobacco Day maybe next year. So the media should be so much alert about the tobacco industry and how they are trying to circumvent the law. There is a ban on advertising, promotion of tobacco products. So I think this one should be alive to all the media houses and also the journalists. They should not work for the industry to promote their products. Lastly, I like to commend the government, but this is too late. 20 years later, imagine, since 2004, that's when we are talking about these farmers who have been here for so many years. So we have lost so many lives, so many people have died, so many children, the issue of child labor in the tobacco farms. So it's too late, and we need to actually put more effort so that we block out the tobacco industry from reaching out to these farmers, because obviously they are not happy. We are working against their business, and also make sure that we come out strongly. The whole world is now watching Kenya. What shall we do? And the issue of enforcement, I think Dorcas, the government should come out strongly and enforce the laws that are there. Thank you.
All right. Thank you very much. Start with your name.
Yes, my name is Eric Omondi. I'm representing Students Campaign Against Drugs. And my take is, tobacco, its effects goes beyond the health effects. It goes to economic effects and the social effects. Back at home, there is diversion of resources, whereby parents divert resources that may be used in other ways to buy tobacco and other drugs. So we believe that we should approach tobacco control through reducing demand and reducing supply. By reducing supply, I mean that we can discourage tobacco planting in Kenya. Reducing demand, we can increase the cost of tobacco to make it unaffordable to many people.
All right. Thank you. I have two more youngsters back there who haven't said anything, but I'll come to them in just a bit. Let's start with you, Dorcas. And there was a question about the sustainable conversation on people who are already struggling to stop? I mean, 95% of them have attempted to stop but have been unable. How are you dealing with that as a government?
Thank you very much. Cessation or interventions for nicotine dependence is one of the key tobacco control interventions, and the government of Kenya has actually prioritized it in the law and is part of the FCTC, and we have built capacity around the country for health workers to provide cessation services, and we are working with the county governments to integrate tobacco cessation into healthcare systems, including at primary healthcare and community settings. So this is, maybe I forgot to say it, but actually we are intervening for that. And in addition to providing cessation services for people who are already using tobacco products, we are also making it difficult to consume, difficult to buy, and therefore motivating people to quit. So it's not just the intervention of providing treatment, but also providing an enabling environment to stay quit and to prevent relapse, and also to motivate the person who are using to quit and to stop other people from initiating, particularly the youth.
Yeah.
Besides that, there are many achievements that Kenya has made. One of the participants said, audience said, that the non-communicable diseases are on the rise despite the tobacco control measures that we have put in place. Indeed, the effects of tobacco take even up to 20 years or more to show. So we will still see a rise in non-communicable diseases because the population that was consuming tobacco now has become come into play. The effects of tobacco is coming into play. But we are trying very much to close the tap, not mopping the floor, so that we stop people from consuming tobacco and start to clean the floor by mopping up, intervening for people who are already sick, people who are already consuming tobacco products.
But even then, the use of tobacco further exacerbates these non-communicable diseases.
Yes.
In fact, if you're using tobacco, you're more prone to having more illnesses. We even saw it during the onset of COVID-19. Those who were tobacco users had more devastating effects on them.
Yes, and it comes to the issue, somebody asked why it is in medical services and not public health. Tobacco as a tobacco control agenda, as Eric Omondi said, is a really complex agenda. It can also be placed in, let's say, treasury. It can be placed in planning. It can be placed in gender. It can be anywhere. But the entry point was health, and it was the effects. That is the non-communicable diseases, and they go hand in hand. Even in the SDGs, you will see that tobacco interventions for agenda number 3, SDG 3, includes tobacco control under. So we have NCDs highlighted and tobacco control highlighted. So they go hand in hand. And cessation and awareness, we have also integrated into the prevention of non-communicable diseases, because this is a major risk factor for them. And in addition to that, they are consumed with other products, which also the government has put in place measures to help people to rehabilitate people from consuming other substances. In fact, tobacco consumption is the gateway drug. People experiment with cigarettes and other tobacco products, and they slowly graduate to other tobacco products. So those are some of the things. Yeah. It's not too late that we have intervened for farmers. It takes a lot of time, a lot of expertise, a lot of money, and also to convince the farmers initially. I have done tobacco control for a very long time, and my first time to see tobacco growing is a long, long time ago. I don't want to see, you will calculate my age. But I went to Migori. Yeah. And imagine all those years, we are now being able to, with partners, to intervene. But the drumming up for support for alternative livelihoods began a long time ago, even before the Tobacco Control Act. And now we have partners. It's very expensive. It requires agronomists. It requires environmental specialists. It requires much more than just health interventions. So putting up together the expertise and also finding finances, convincing the farmers who are already in debt with tobacco industry, and also fighting the tobacco industry interference when we are trying to convince farmers to stop growing. And this is a problem. But I'm happy to report that between 2010 and 2019, tobacco growing in Kenya already had reduced because of the interventions we had put in place. Yeah. So it reduced from about about 19,000 hectares to about 17,000 hectares. And the leaf production even reduced by almost half in the same period. So maybe the leaf has decreased more during that time because tobacco really leaches the soil. It consumes all the nutrients. So gradually the production reduces, the output from the farm reduces.
Is there any safer tobacco product? Because I've seen that also going on the media.
Thank you very much for that question. It's very important. The quickest way to addict people to nicotine is using absorption through the lungs. That's why cigarettes are the most consumed tobacco products globally and even in Kenya. And with the control of tobacco smoking and consumption of inhaled products, the industry has become innovative and produced other substances, we call them novel and emerging products, which they try to market them as if they are less harmful. Tobacco consumption is harmful in any form. Whether you smoke it, you suck it, you sniff it, it is all harmful. Even vaping it. And they try to lie to the youth that this is not a tobacco product. All those are tobacco products because they have nicotine, and the nicotine in these products, although they claim is synthetic nicotine, some of the products that they have claimed that when we have tested them, they have organic nicotine, which is from the plant. And so there's no safe alternative. All of them are harmful, and you cannot choose one over the other and say, I will use this because it's less harmful. It's still harmful, and it's severely harmful because, as we have said before, tobacco consumption is a risk factor for the 6 out of 10 major causes of death in the world.
Okay.
And so there's no safe alternative.
All right.
And the comment somebody made that Kenya should ban advertising, it is completely banned to advertise, promote, and sponsor by tobacco industry. It is completely banned to advertise or promote tobacco products and tobacco consumption.
But have you been able to keep up with the digital world now? Because
now we have the digital world, which is selling online on online platforms. Yeah. And in addition to that, we have actually worked with the Communications Authority and other outlets to inform them that advertising and sale and delivery of tobacco products is prohibited by law.
Okay.
Yes, and we also call upon the youth, the young people. We work with them very closely. You can see the audience is very young. We work with them and they keep us on our feet.
Yeah.
And we urge them to share with us when they see some place where they're advertising, or even when they have information on who is delivering tobacco products to young people, so that we can work with the counties and other agencies to actually intervene.
All right.
Yeah.
Dr. Adriana, how do you incorporate the young people, the role of the youth, that, like they've mentioned, there's nothing for us without us? How do you make sure that they are part of this campaign? Because in the long run, it is expensive, we admit that, but how do you sustain this conversation?
Okay, I think that I totally agree with the person who said that the youth is an integral part of this conversation, definitely. And I have a conversation when I just arrived with some members of civil society saying, I want to retire. So if some of them don't take my space, I will need to stay here forever. So yes, we need, for two reasons mainly, because they are an important constituency and because they are the focus of the tobacco industry. When the tobacco industry say that they are producing, for example, new products for the people who already smoking so they can have something less harmful or they can quit, no, they are marketing to the youth, okay? Because they are promoting in features that you see are now there are some new products that are with toys. You look at them and you cannot realize that this is a tobacco product. How they can be incorporated? Well, I think this is, Kenya has groups already with people young, and I think in the last Saturday we celebrated at WHO the 20 years anniversary of the adoption of the convention, and we have some people that are members of the youth council that Dr. Tedros has convened, and I was talking to him about the need that we have to talk to them about the tobacco product, the tobacco problem, sorry. And really they need to be incorporated in the country discussion, and I think in the multisectoriality that we are promoting for achieving tobacco control in a country is not only all the minister, but the civil society, but also all the constituency, even in countries where there is other ethnicities that need to be represented, because the convention take into account all the different groups, okay? They cover the needs of all the different groups and vulnerable groups.
Okay. Frederick, how long did it take to convince you to move from tobacco farming? Because you've done this for years, almost 20 years.
I did it for a very long time.
Yeah.
But it took me only 2 years.
2 years?
Yes.
So you had already heard that you need to transition from tobacco to something else, but it took you 2 years to transition.
We had a youth group,
of
which I'm the patron. So we were one day called by one of our agriculture officer in the sub-county, where he had got a demonstration plots of the types of beans. So he called us there, and we were taught. And then we were asked to select the good beans from the demonstration plots. And we ended up selecting these Nyota beans.
Yeah.
So it is that group that I'm the patron to, that started growing the Nyota beans in that area.
Yeah.
So from that product, I was convinced that the income for the Nyota beans is better than that one for tobacco.
Okay.
It just took me 1 season.
Okay.
Yes.
Almost 2 years. Lucas, this is an interesting conversation, because if it takes that long to convince one farmer, how long does it then take on average to convince the rest of the farmers? And how are you in the county including the youth in this fight? Because I'm looking at 2 different ways of dealing with this. Either the tobacco industry is using more innovative ways, more youthful ways to end up appealing to the younger people to use tobacco products. It means the only option you're left with then is to give the counter to that advertisement, which then means the impact of using that tobacco on young people. How are you using young people in your county to deal with this?
So I will begin with the first question that you asked. How long does it take to really create the required change? Now, normally in the process of building change, the initial step is a lot more difficult. The initial push becomes very difficult. But subsequently, the more you have farmers engaging others and demonstrating the benefit, then the incremental is 1 to 2 to 4 to 8, like that, because then you begin having a bigger critical mass that facilitates the conversation. So it is true. The first 2 years have been fairly. We have done a lot of heavy lifting, but we anticipate that as we go into the 3rd, 4th, 5th year, then it goes a lot more phenomenally than just 1 + 1 + 1.
Okay.
About the youth, clearly there are certain characteristics of the youth that we as extension workers and change agents already understand. One of them is that young people are not interested in something that doesn't bring in money. And therefore, the options that we are bringing, obviously, are options that target young people. And young people are also, this is statistics that we have. They are not very keen on long-term, something that takes too long. The 1 year of tobacco farming that has been talked about. Young people want something that is quick, brings in money, enough money in a short period of time. And the options that I'm already talking about here are options that really fit the bill. Short season crops, 60 days, 90 days, you have a crop. You can actually do 2 seasons in a year rather than having to wait for 1 crop over an entire year. But also, we have involved them through their youth groups within the county. we understand that there are a very easy vulnerable target, and it is the one category of persons that we are really targeting with the relevant information about the side effects, not just about smoking, which is done by our public health team within the county, but also about the dangers, the would-be dangers of growing the crop.
Okay.
So that if they ever choose to take the route of growing the crop, then they are fully aware of the kind of risks that then they expose themselves and their families to.
Okay, we're running out of time here, so I'll come to my panelists to give closing remarks, but there are two people whose voices I haven't heard back there, so if you can have the microphone, both of you, the lady and the gentleman, start with your name and tell us how you think you can be involved, because now we're switching the question back to you. As young people, what can you do to ensure that we stop tobacco farming?
Okay, I'm Joseph Humphrey from Den of Hope. As Dr. Kitui has said, how can we stop the tobacco back to the street? It's upon us as a youth to come upon this agenda of tobacco and come with a solution to how we can help the youth back there to get the knowledge.
Okay.
Yes.
All right. Yes, you have the microphone.
Okay, I'm Daylene Murray, a member of Student Campaign Against Drug. Okay, how we can help stop the youth, or we can help control tobacco. I think us as the youth, we need to come up with different ways, create awareness to people, the friends around us, and also come up with ways that we can help control tobacco.
Yeah.
Also have a quick question to Dorcas. How sustainable are the conventional measures towards controlling tobacco? As you said about the global and the international laws. Yeah, and how do you think as Kenya by 2030, are we in that position to achieve the SDG 3?
All right.
Yeah.
Pass the microphone to him, because you're the one who raised this conversation around involving the youth. How do you think they should be involved?
Well, one, I'm really tired of always hearing that the youth always like quick money. The question is, who doesn't? Everybody does. And as I said, we have the ability to learn, to unlearn and relearn. It's about time that our country stops using the youth as scapegoats. Involve us. My key take is involve us.
How do you want to be involved?
From the moment that you begin in the policy, from the policy process, involve us in that. When you're actually doing that research, involve us. Don't tell us that statistics do say this and this, and we never really even saw any study being conducted. Let us be there. Let us be part of that validation, actually say like, yes, this is actually true. Let us be the ones who also take part in conducting those studies so that we can actually verify and do consider us whenever you're planning anything by involving us in those processes. And then, again, as I said, it takes time. That's how we get to learn. Give us that space, let us articulate our issues, and then afterwards, blame us if we don't play that part that way.
But are the young people organized enough to be involved? Because you see, the question is, if you ask me, okay, I'm a senior youth, I'm about to leave that youth bracket, but if you ask me, then I'm the one part of the people giving the statistics to them. The fact that you have not been asked doesn't mean that the youth have not been contacted. So are the youth organized enough that you know this is the body that speaks for the youth, and this is the other one that speaks for this and that?
Ombija, yes, we are. And that's why I'm here tonight. If I wasn't, then I wouldn't be here. I mean, I come from Den of Hope Youth Group, and part of what we do is advocating towards tobacco control. So that in itself speaks a lot, and we've been doing it independently. And that's where KETCA, Kenya Tobacco Control Alliance, came on board and took us. I myself am a tobacco advocate and champion. I'm a trainer. In order to have that passion, it takes quite a lot. So Are we organized? Yes, we are. We do not wait for global action days to come and talk about tobacco. That's one of the things that we've been doing in Kamukunji, Isili, and its environs, Mathare. We've been doing it, and it's something that we do every month. And if someone needs statistics for that, come and ask us, and we will give you. Thank you.
All right, brilliant. Yes, yeah, quick remarks, yes.
Just a quick remark.
Yeah.
Yes, the youth are very organized, as he had mentioned. There is Den of Hope represented here. Students Campaign Against Drugs, Kenya Tobacco Control Alliance, and many, many other civil societies and governmental organizations.
Your microphone is off. Switch it on again.
Sorry, let me come again. Yes.
You start again.
So the youth are very involved and are very organized, apart from there being various civil societies, Students Campaign Against Drugs, Kenya Tobacco Control Alliance, Den of Hope. The list is endless. Youth are very organized and we can mobilize very fast.
Okay.
And in addition, we're in schools, we're in universities, we're in colleges. So we're very organized and we just hope for stronger collaboration. There's a lot that we can do. Apart from sensitization, we can also be involved in legislative processes and also being the watchdog. So, because we're on social media and we are seeing what the industry is doing and we're coming.
All right, I'm sure Daktari has something to say, but I'll come to you first. Yes, then Daktari over here.
Me, I would say a better way of involving the youth, those that are organized like this, make sure that the resources are available for these people to do this work.
Okay.
I'm very sure we have a tobacco control fund that has been developed by the Ministry of Health. And we want to see this money going down to the youth so that they can continue pushing back what the industry is trying to do, because the industry is targeting these people. So we should use these people to oppose what the industry is trying to do. Yeah, so for sure, resources are needed.
All right. Yes, final remarks.
In my opinion, the best way to involve us is to tell the story, tell our stories. Okay, so we should get people who have been afflicted by this and then document the process. Have they been successful at eliminating the tobacco in their lifestyle? And if I have the time, I would like to tell you a story. Yeah?
Very briefly. You can summarize.
Yes. Yeah. So a friend of a friend, okay, the significant other was smoking three sticks in a day when they were coming together. Okay. And he looked at her as a woman, why are you smoking? The lady confessed that it has been an issue for me to stop. So as a gesture of love, this gentleman decided to take on the smoking so that they can stop smoking together. As we are speaking, the gentleman smokes 2 packs a day and the lady doesn't smoke. That is how bad. Now,
so the roles were switched.
Yes. So the gentleman is severely addicted to tobacco and he has been trying for over the years to stop without success, and the lady stopped ages ago. So if somebody were to come to me and tell me the story, put it in that manner, it is easily receptible, as opposed to giving us banners with spoiled teeth, and it becomes... If you're telling me my story through me, through my eyes, through the eyes of people who've been going through the process, it is much, much easier.
Okay. All right. Closing remarks, and I'll start with you, Lucas. Interesting views from young people there. And this is coming to your county. So what do you intend to achieve at the end of it all? What is your picture of success, having heard what the young people are saying, and this is happening in your county?
Well, I think first for us as Migori County, we are greatly excited and honored that we will be hosting this particular event on Wednesday. But of course, that comes with an additional burden in terms of meeting the expectations of our farmers who are still dependent on tobacco. And we are really looking at that particular forum being the platform where the successes that have been mentioned within in the war, those successes are profiled higher, and obviously it will accelerate the change process that we are dealing with. But it's also an opportunity for many other stakeholders and players out there to begin focusing in terms of how do we partner with the county government of Migori to cover more ground so that we reach more farmers and address the wide range of farmers who require alternatives.
Okay.
Yeah, so that is really our big-term goal in terms of what we want to see in the short term.
Frederick, what would you tell other farmers who are watching you tonight? What is your message to them?
The first message will go to the government first, that these alternative crops should have standard price to compete tobacco, not price that is fluctuating, that if we produce more, the price comes down. And when we don't produce more is when the price comes up. Let them have the standard price so that we know that if I grow this crop, after the production, I'm going to sell it at this price. And to micro farmers who I know they are watching me at home, I'll encourage them that there are a lot of negativity from tobacco. So if they haven't successes in their lives and in their homes, let them deviate from tobacco and go to these other crops.
Okay. Dr. Adriana, your picture of success at the end of this all?
I would say in general, the increased implementation of the treaty, because I really believe that the treaty is a good solution. In more related to this World No Tobacco Day, to see that the experience is extended in more counties and is extended to the whole country, and then we can show this experience in other countries that can go in the same, and we can have less production of tobacco with healthier farmers with a better livelihood. Really, I think that will be a great success.
All right. Dorcas?
Thank you very much, Trevor. I am very happy to inform the youth that Den of Hope was part of the groups that actually advocated and lobbied for the Tobacco Control Act. So the government has been involving you, and we still continue to involve you. We work very closely with the youth groups, and we've had, even in the research, when we are doing research, we give priority to the youth to collect the data. So we are involving you. So if it is not just you, but many youth are involved. And I think some of the people in the audience, and actually some of the youth that are watching, are already working with us. But we welcome your proposal to strengthen our collaboration, and for sure we will do so. And I would like to please urge the youth that the new products and emerging products are not safe at all. So do not be lied to, and do not want to be to associate with the trend, because it is going to harm your health terribly, and you might not live to become an adult or a grown. You might not live to see what life is, because these products are really, really, really dangerous, and there's very limited evidence and statistics on the content and the harmfulness of these products, and do not be lied to that they are any safer.
All right.
I would like to thank all the partners that have helped the Ministry of Health and the government at large to implement the FCTC, and also in particular the Alternative Livelihoods Project, the tobacco-free farms. We started in Migori. Initially, we piloted with 330 farmers, and now there are over 2,000, as Mr. Mosenda said. And the government is now expanding with the same partners to other tobacco-growing regions. And so I urge people who are using tobacco products to quit using tobacco products. The Ministry of Health is available to provide services, and I will work with Dr. Nadab to actually address one of your friends' issue, and many other people. Go to the health facility and you will receive services. Okay. So we encourage the youth not to try, because nicotine is a highly addictive substance, and as witnessed or testified by one of the youth, trial leads to addiction. And it is very hard to quit using nicotine. So I urge anyone who is not using not to try it, and those who are using to quit using tobacco products.
All right.
I would like to take this opportunity also to inform the public that due to the success of the tobacco-free farm project in Kenya, it is the first in the world to be successfully implemented in that scale. And so we are privileged that the World Health Organization has decided to launch the global campaign for Grow Food, Not Tobacco in Kenya.
Yeah.
And we thank the Migori County for hosting on behalf of the country.
Okay.
And join us, our Cabinet Secretary will be Nakumincha Wafula will be the chief guest, and we have other guests there, so we invite you to watch.
All right.
It will be live streamed.
All right. Thank you so much for that. And this conversation is happening in Migori County. The host governor, Dr. Chila Yako, spoke to me earlier on, and this is what he had to say.
I want to welcome everybody, all Kenyans, all Migorians, to celebrate with us in Migori at a place called Sibuoche, the World No Tobacco Day. We, as Migorians, are happy to host you. We, as Migorians, want to lead from the front in saying no to tobacco because we love being healthy and we also love eating well. So we want to say no to tobacco and in exchange for that, grow more food, earn more money, feed ourselves well, and live a happy, healthy, and wealthy life.
All right, thank you all for making time this evening. Dr. Adriana Blanco, Head of Secretary WHO FCTC, that is the Framework Convention on Tobacco Control. Dorcas Kiptui, Head of Division of Tobacco Control at the Ministry of Health. Lucas Mosenda, CEC Agriculture in Migori County. Frederick Omondi, Farmer in Migori. And most important, our youthful team for all the insights that you sent through. We appreciate that every single time. And on behalf of the entire team that made the Monday Report happen, we say thank you, good night, and God bless. Bye for now. My name is Trevor Ombija.